Good morning, everyone. Welcome to today's Healthy Aging Lecture. I'm Kate. I'm the manager in the Senior Health Department here at VHC Health. And I am joined today by Dr. Brian Clark, who is a board certified cardiologist with VHC Health Cardiology. And today's topic is on blood pressure control. You may not be aware, but May actually is National Awareness of High Blood Pressure Month. I guess there's a month for everything, but we thought this would be a good time to bring this presentation to you. I think high blood pressure is often referred to as that silent indicator, or that really helping us to understand our health and our cardiology health as well. So this would be a great time to learn more, and we wanted to let you know that this presentation will be recorded, so you will get a link to the recording early next week. And we definitely welcome your questions. So if you have any questions, please feel free to enter those in the question box, and we'll be reviewing them as we go along. At this time, Dr. Clark, I'm going to turn it over to you to continue with the presentation. Thank
Perfect.
you.
Thank you so much, Kate. And thank you everybody for taking time out of your day to tune in. This is a really important topic, not just in sort of the general sense for cardiology, but specifically for me. I have a lot of friends and family that have high blood pressure, and it's a topic that we talk about not just sort of in the clinic setting when I'm seeing people, but also in the hospital and among family and friends, because as Kate said, this is sort of a silent condition in a lot of people's cases, but the downstream effects of having high blood pressure, especially if it's severely uncontrolled, can be pretty significant for people. So I do want to make sure that I'm able to convey some helpful information to you, and hopefully generate some interesting thoughts, if not questions, during the course of the time of this talk. Okay, so I'm going to get started. All right, so the objectives, we're going to talk about blood pressure basics, talk about the effects of high blood pressure, some risk factors for high blood pressure, as well as strategies to try to reduce blood pressure. Okay, now this is not an exhaustive talk. This is something that we can spend hours and hours and hours talking about, but like I said, I want to try to give a summary of some of these topics, and certainly encourage you to ask questions either to me or when you're seeing your doctor, so we can go into these things in more detail. Now, the silent killer. So nearly half of the American population over the age of 20 has high blood pressure, and a lot of people don't even know it. There's usually not always signs or symptoms that would indicate that, and the risk factors that increase your chances of developing high blood pressure sometimes are modifiable, but sometimes are not. So I think that's what makes it tricky. Really, the only way to know definitively about having high blood pressure is to get it checked, but a large number of people may, for one reason or another, never get it checked, either because they're not coming to the doctor's office very often, or because they just don't feel unwell. But that's not a prerequisite for having high blood pressure. High blood pressure is usually something that develops slowly and over time. And like I said, there's lots of different factors that can contribute to it, which we'll talk about a little bit later. But it is a significant contributing factor to developing heart attacks, strokes, and other type of health conditions outside of just sort of heart-related conditions. So blood pressure statistics, just to reinforce this, 67 million Americans have blood pressure, and actually that might be an underestimate. This data is from a couple of years ago, so I imagine that probably even more people have high blood pressure than is actually known. 53 million, based on this information, were actually aware of high blood pressure. 47 million actually had treatment undergoing, and even less actually had a controlled level. And like I said, while these numbers might not be exact in reflecting where we are right now, I think the general sense is that it's underdiagnosed and undertreated, and that's something that we see play out day by day. So this is not something everybody has to answer sort of out loud, but have you had your blood pressure checked in the last year? I think the answer to that probably for a lot of people is no. And again, to what I was saying before, if people don't feel unwell, they might not feel compelled to unless they're going in for an urgent care visit for some other reason completely, or if they just go for a routine checkup to their doctor's office. So what is blood pressure? Essentially what it is a measurement of the amount of blood or the pressure of the blood that's pumping through the blood vessels, the arteries specifically, and what that pressure is on the inside of the blood pressure, or sorry, inside of the blood vessels. So the heart supplies all the tissues and organs with oxygenated blood after you breathe in and breathe out. That blood flow that's going through your lungs circulates back through your heart and goes out to the rest of the body. Every time the heart beats, every time it squeezes, it pushes blood forward through these blood vessels and kind of delivers that oxygen to the rest of the tissues within your body so that they can function appropriately. That portion of the sort of cardiac cycle, as we call it, where the heart is squeezing, is called the systolic or systole phase. And then during the relaxation, it's called the diastolic or diastole phase. And that's what we're measuring when we're checking somebody's blood pressure. So this reinforces that the systolic number and the diastolic number. Now, the way we check that is with a blood pressure cuff around the arm. We usually will inflate it using one of those sort of balloon-looking mechanisms, or these days, a lot more of these are electronic. So it's something where you just put the cuff on, push a button, it inflates. And what it is doing is measuring when there's actually pulsations that are detected, both the first pulsation, which would give us the systolic number, and then the last pulsation before we kind of lose the audible sound when we're listening, and that gives us the diastolic measurement. So some questions that people often ask when we're in clinic or just in casual conversation is, which number is more important? Well, actually, both of them are important, both the systolic and the diastolic, and sort of for different reasons. But one thing that generally we would say is a consensus is that as people get older, particularly over the age of 50, the systolic reading becomes even more significant. And the degree to which that number can be high for some people will be even more prominent compared to the diastolic number. Other questions that people will ask is, should I check my blood pressure in both arms, one arm? Does it make a difference? Well, actually, it does. I think that checking in both arms whenever you're checking your blood pressure is important, because sometimes there can be big discrepancies from one arm to the next. And actually, sometimes that can indicate that people may have abnormal anatomy in the blood flow to either arm. And there's sometimes when they have conditions that need actually procedural treatment to fix. So it is important to check in both arms when you are checking, and make sure that you share that with your doctor when you are talking about what your blood pressure measurements are. Another question that comes up sometimes is that mmHg, so that's millimeters of mercury. So mercury was kind of the first method that was used in pressure gauges to get a sense of blood pressure. So that's why we use that as a marker of blood pressure specifically, as opposed to some other types of measures that might be used in other circumstances. So how to check your blood pressure? That's also a big question that I get, because sometimes people will check their blood pressure at maybe not the best time. So we usually recommend to people when they come into the clinic for what they should do at home. We usually say maybe in the 30 minutes before you check your blood pressure, you really shouldn't be doing anything tremendously stressful, like smoking or drinking caffeine or any kind of exercise. Driving obviously sometimes can be stressful, so we recommend against doing anything like that leading up to the time that you're going to check your blood pressure. 5 minutes prior to, you really should be sitting still, sort of in a quiet environment, probably not having a conversation with anybody, no kind of distractions from the TV or anything like that. During the course of the time when you're checking your blood pressure, you should make sure that your cuff is kind of around the arm, and we'll talk about that a little bit later too, but make sure it's on the arm, either on the left or the right, that your arm is on a flat surface, either at a table or something that can keep it perched up, sort of at the level of the heart. And you should be sit upright with your back straight and your feet flat on the floor. So we'll tell people to check their blood pressure at one point in time, get that measurement, and then wait about another minute and then recheck it. And sometimes we'll even have people check it 3 times just to see if there's some consistency and even get an average. Sometimes what we will see is that the first measurement may be highest, and then on the subsequent measurements, the levels might actually decrease little by little, or even pretty significantly. So that's why it's important to check it more than just kind of the one time. And then always important is to make sure that you're keeping track of what your blood pressure levels are, because it is important for us especially when people come into the office, we'll have a conversation about what their blood pressure measurements are. If they're not keeping track of it, or if sometimes if their blood pressure monitor doesn't store all of that information, we're sort of guessing what the numbers might be, which sometimes makes it tricky in terms of making decisions whether or not somebody needs to, for instance, be on medication or not. So I think these are some important steps to keep in mind when you're checking your blood pressure at home day by day, or even week by week, depending on the frequency. And this picture here is from the CDC website, essentially reinforces a lot of the things that I just spoke about. All right, so blood pressure categories. So this is sort of the guidelines that we follow in general in terms of how we label different blood pressure levels. But in terms of what that translates into in terms of treatment, it can be variable from person to person. So traditionally, normal blood pressure is considered less than 120 on that systolic number and less than 80 on the diastolic number. Elevated blood pressure, as it's called, is between 120 and 129 millimeters of mercury, and then less than 80 on the diastolic number. Stage 1 hypertension is 130 to 139, or 80 to 89 for the systolic and the diastolic, respectively. And then stage 2 blood pressure is 140 or higher for the systolic, or 90 or higher on the diastolic. And then we have another category that we actually label as a hypertensive crisis. So that's when the systolic number is greater than 180, or the diastolic is higher than 120. Now, that is a pretty critical level that we get worried about, because if the blood pressure is at that level or higher for a sustained period of time, that actually can cause damage to organs. So I've seen situations where people get to that level and have strokes or kidney issues or issues with their breathing as related to their lungs, or even damage to the blood vessels internally because the blood pressure is so high. So that's why it's really important to identify if your blood pressure gets up to that level. Sometimes we'll also absolutely make sure that we recommend that people check their blood pressure repeatedly when they see levels at that sort of cutoff. And if it's consistently that high, we either recommend that they get in touch with us, or even sometimes if they're feeling some sort of symptoms related to that, they go to the hospital to get more acute treatment. Now, on the opposite side of the spectrum is low blood pressure. Now, this is, there's cutoffs for what we would consider low blood pressure, but it is relative from one person to the next, whether or not it's something of significance. Some people just have a low resting blood pressure, and I've had many people that I see that have been told for their entire life they have low blood pressure, but they feel fine with it. Typically, that cutoff, depending on the circumstance, would be less than 90 for the systolic number, less than 60 for the diastolic number. Some people may not have any symptoms, but some people may feel all of these things that this slide demonstrates, such as dizziness, lightheadedness. They might feel like they're going to lose consciousness, or they might actually lose consciousness. But other things such as blurred vision, cold or clammy skin, feeling very fatigued, those are sensations that people might feel if their blood pressure is low. But not everybody feels that at the 90/60 cutoff that I described. Sometimes I have people that feel that kind of sensation when their blood pressure is at about 100 for the systolic number. And it's a little bit variable depending on the person. So there's not a one size fits all when it comes to what constitutes low blood pressure for one person compared to another person. And I mentioned this kind of on a previous slide. So the consequences of high blood pressure, this is why we get really concerned. So there's a risk of stroke, heart failure, heart attacks, issues with vision, kidney disease, and actually some people have dysfunction in terms of erectile dysfunction in men, or even lower libido in women. So it is important because it affects a lot of different organ systems. So we take this very seriously, especially if the levels are extremely high. So what does each category mean? And I mean that to say, what do we do if we do see these numbers are within certain ranges? So if somebody's in a normal range, sort of that 120/80 or less, not too much that we would recommend, sticking with heart healthy habits, following a balanced diet, getting regular exercise, and we'll just kind of monitor it from there. If they're in that elevated range, we certainly will continue to encourage that, but we usually will start digging into some of the factors that might be contributing to people's high blood pressure, which we'll talk about a little bit later. It doesn't necessarily result in somebody needing to be on medication within this range, but I think we have to be a little bit more vigilant, pay more close attention if the blood pressure is within this range, and make sure any reversible causes of blood pressure being elevated are being addressed. For stage 1 hypertension, in addition to lifestyle changes, this might be the circumstance where we start thinking about medication. And again, it's individualized based on somebody's particular risk factors for it. And if they have any type of conditions related to their heart or any other kind of organs, in which that blood pressure range may or may not be sort of a safe range to keep them in, or if we need to be a little bit more aggressive with bringing it down to a lower level. For stage 2 hypertension, that's usually up to that 140/90 or higher. That's usually when we recommend blood pressure medication. Now, if somebody has a single blood pressure measurement that's in this range, but they check it on a couple of other occasions and it's lower than that, that might not be necessary. But if we're consistently seeing 140/90 or higher, medication absolutely is something that will discuss, whether it's one medication or a combination of medications, because again, we're trying to avoid any sort of negative effects, not just in the short term, but in the long term as it relates to these organ systems that we talked about. And then hypertensive crisis that we talked about, that oftentimes will require urgent or more urgent medical attention. If the levels are greater than 120/80, again, recommend to people wait a couple of minutes, check it again, see if it's consistently high, because there are circumstances where maybe the blood pressure cuff isn't measuring it appropriately, or perhaps the person might be extremely in a stressful situation. We'll tell them to check it again after a couple of minutes. And if it seems like it's persistently high, that would be the situation to either contact myself, contact another doctor that you're seeing, or in worst case scenarios, probably find a way to get yourself to the emergency room, because these are circumstances where we want to make sure we get that blood pressure down to a safer level so that you don't develop any of these kind of symptoms that we had spoken about before. And these symptoms can be chest discomfort, shortness of breath, back pain, vision changes, headaches, numbness or weakness in your extremities, like in your fingers or toes. All of those things can be manifestations of high blood pressure. And if you start feeling that way, that's a situation where seeking out medical attention is absolutely important. Another entity that we see from time to time is white coat syndrome or white coat hypertension. Now, that's a circumstance where we have people that come into the office, their blood pressure is normal when they check it at home, but when they step into the doctor's office for multiple reasons or one reason or another, their levels tend to run high fairly consistently. It's given that name because we wear white coats on a number of occasions in the office setting or in the hospital setting. But the indication is that in these kind of environments, outside of being in the home, somebody's blood pressure will be relatively higher or extremely higher. And I'll say in circumstances that I've seen, oftentimes it's because the doctor's office can be stressful, particularly the cardiology office. You know, people are worried about getting bad news about something, or even sometimes they're rushing to get to the office, or, you know, they're in kind of a stressful phase of life. So when they get into the office, their blood pressure might be high. Whereas when they're at home, they're more relaxed. It's more of a familiar environment. The blood pressure is in the normal range. It is important to identify this kind of diagnosis from my perspective too, because sometimes we may recommend somebody wear something called an ambulatory blood pressure monitor, whereas we have them wear a monitor to check their blood pressure at home over a 24-hour period and see what the fluctuation over the course of the day for their blood pressure might be. Because there are some times when people with this kind of condition actually do end up needing to be on medication, even if it's to a minor extent. All right, so risk factors. This is something that comes up, and this is what we get into with all the people that we see whose blood pressure is high. What are the risk factors for elevated blood pressure? So there are things that we consider modifiable and not modifiable. So family history, you know, I have a lot of people that I see, they say lots of members of their family, for one reason or another, have high blood pressure through many generations. We try to dig into what are those things that might be contributing to high blood pressure, obviously. But if there's a trend that multiple people in the family have high blood pressure, sometimes that might be one of the biggest risk factors or one of the biggest reasons why somebody's blood pressure is high. Another factor that's not within our control is age. I know as you get older, your blood vessels become stiff, they become more hardened, and blood pressure actually rises generally in people as they get older. And that's not necessarily something that's behavioral, that's just sort of physiologic. That's how your body changes sometimes as you get older. Now, that's not the case for everybody, but we do see that in a segment of people. Gender, you know, we tend to see more elevated blood pressure in men more than women. In terms of race, African Americans tend to develop higher blood pressures more often than other racial backgrounds. Although we don't make that kind of generalization for everybody, we take each individual situation into account, but that's the trend that we will see from time to time. Chronic conditions that may or may not have any relationship to blood pressure issues. So people with chronic kidney disease, people that are on dialysis, people with renal artery disease, they may be more likely to develop high blood pressure too. And then thyroid disorders, particularly maybe overactive thyroid or like hyperthyroidism or hypothyroidism too. That's a condition that can cause people's blood pressure to be high, which is not necessarily something behavioral, but something that people may develop for other reasons, but that definitely can have an impact on the blood pressure. Modifiable risk factors, this is what we talk about 99% of the time. Physical activity or the lack thereof, diet we get into, because there are a lot of things that, especially in the American diet, that can promote high blood pressure. So things that are high in calories, high in saturated fats, trans fats, high in sodium and sugar, or too little potassium. I would say in a large majority of people that have high blood pressure that I see, there's usually some degree of dietary component that probably could stand to be improved. That usually translates into improved blood pressure as a downstream effect. Body weight, so being overweight or being obese absolutely has been linked with high blood pressure. And on the opposite side of the spectrum, losing weight or reducing weight over time has definitely been shown to cause people to have a decrease in their blood pressure too. Alcohol consumption, and we'll talk about that a little bit later too. Alcohol consumption absolutely independently can make your blood pressure higher. I'm not necessarily talking about having a glass of wine every once in a while. I'm talking about regular alcohol consumption day by day or several days out of the week. Another condition, sleep apnea, which is probably underdiagnosed, is a condition where people have issues with their breathing patterns during the course of the night when they're sleeping. That can actually translate into high blood pressure in people, even if there are no other factors at play that might be affecting it. So oftentimes we'll look for any evidence of sleep apnea if we're looking for a particular cause and if all these other risk factors might be ruled out. Type 2 diabetes, another thing that can cause elevated blood pressure, maybe not directly. High blood sugar isn't always directly causing high blood pressure in the way that, for instance, high sodium consumption might be. But what happens with diabetes is that it can damage the blood vessels, damage the heart in various ways, and it can, as a result, translate into high blood pressure over time. Smoking and tobacco use, multiple components within smoke, cigarettes and tobacco can cause increase in blood pressure and can damage arteries. And again, as a downstream effect, can elevate the blood pressure. Stress is a major one, especially in this area. It's a particularly stressful time. But I've seen that in and of itself be a reason why somebody's blood pressure is high, whether that's due to personal stress or work-related stress or just generalized stress. So we make sure that we talk about all of these things whenever we're trying to, again, get to the bottom of why the blood pressure is high and figure out ways to try to address this as best as we can. And then there are other medications that people may be taking or substances or drinks or things like that that can raise the blood pressure. So caffeine is a classic one that I talk to people about. So folks that drink a lot of coffee or tea, if it has a high caffeine component, absolutely can translate into elevated blood pressure. So I want to make sure that I talk to people about that too and make sure that if that's a factor, maybe talking about reducing how much they're having day by day so that their blood pressure isn't going up as a result of that. Now, prevention. That's another big portion of the conversation that I have with people. Prevention is key. So you have to know your risk factors, which means you got to go and see the doctor. It's really important to identify any of these factors that we've talked about before. Knowing the numbers, so checking your blood pressure either at the doctor's office or on your own with your own blood pressure monitor at home, and then monitoring on somewhat of a regular basis. Now, I'm not saying you necessarily in everybody's case have to check it every single day, but there are some people, if they are on medication, for instance, I'll recommend, yeah, you should probably be checking your blood pressure, if not once or two times a day, at least several times a week. Because it's really important to make sure that, especially if somebody's on medication, that their blood pressure is within an appropriate range, not too high or not too low. This is a form here that I sometimes will share with people that I'm seeing in clinic. This helps them to stay organized in terms of keeping their risk factors for their blood pressure under control, identifying symptoms that might indicate higher or lower blood pressure, and also keeping track of what their blood pressure levels are. And there's various forms of this that we have available for people to use at home, but this is also on the American Heart Association website for people to reach to. So prevention. Other things as part of prevention is risk factor modification. So exercise is part of that. Physical activity, as much as folks are able. Now it's going to be variable from one person to the next, But guidelines recommend that moderate intensity aerobic exercise should be attempted, if not achieved, 150 minutes per week. And that can be in various forms. That doesn't necessarily have to mean you're going and running a marathon. It doesn't mean you have to jog. It could mean, honestly, a brisk walk or biking or swimming. Whatever keeps somebody physically active. A body in motion is a lot better than just being stationary or sedentary. And I know obviously people will have various limitations in terms of what they're able to do or not, but we try to talk about that during the course of our visits when I see people to try to figure out what is possible, what can you do to try to keep yourself physically active. And then not just aerobic activity, but also muscle strengthening, because that's also important too. You do burn calories, you can lose weight, and it actually is good for your overall health to try to do some sort of muscle strengthening activities, especially as you age. And we recommend doing that at least 2 days out of the week. But again, we try to figure out what's possible, what's feasible for each individual. And then heart healthy diet. I know I'm absolutely not the first person to talk about heart healthy diet. It gets talked about, it feels like on a daily basis, what's healthy, what's not. There's a lot of agreement and or disagreement with what should be part of a normal diet. But typically, I recommend to people a plant-based diet, right? So rich in fruits, vegetables, whole grains, trying to minimize dairy intake, minimize red meat intake, maybe more lean proteins, staying away from certain oils, nuts, seeds, things like that are important. Um, I know it's challenging. The American diet is not necessarily conducive to adhering to this, and it can be very tricky to keep up with it. But it does take discipline, and again, I try to have conversations with people when I see them in clinic to try to figure out, okay, how close or not close are you to being able to follow this type of diet, and try to work through how do we accomplish this as best as we can, understanding that everybody's ability to kind of have these kind of foods on a regular basis might be different or more challenging depending on the circumstances. I mentioned this earlier, but sodium is one of the things that I stress to people, especially when we're talking about blood pressure, that is absolutely something should be trying to minimize. The AHA recommends less than 2.3 grams per day. I tell people at least less than 2 grams, but honestly, the less that you take in day by day, probably the better for you. Now, there are some conditions that people have where actually salt intake is beneficial, but for a large majority of people, particularly if it's related to high blood pressure, you really should be minimizing how much salt that you have. Unfortunately, it's in almost everything. Now, to varying extents, but it's in everything, whether or not you taste it feeling, or sorry, whether or not you taste salty foods when you're actually eating it or not, it actually can have a fair amount. So breads, pizza, that's what this is showing, sandwiches, specifically deli meats or cold cuts, soups, canned soups, and then burritos and tacos. I know they use these as examples, but these are generally things that are going to be higher in sodium. So again, this is something I talk to people about very regularly. If it seems like this is a good portion of what they're taking in day by day, they really should be trying to minimize or reduce how much of that they're taking in. This is too long of a list of all the things to go into, but basically what this is demonstrating is that there are a lot of other types of salt alternatives that can give good seasoning and good taste while not having to worry about the salt components. And that's one of the things I talk to people about too. They worry that, if I don't add salt to my food, it's not going to taste good. But there are lots of other alternatives, using garlic, ginger, rosemary, onion powder, not onion salt, mustard. All of these things can add a good amount of taste to food without having to incorporate salt to the extent that I think some people think they need to whenever they're preparing food. Kind of piggybacking that discussion, there's different types of diets that we recommend to people that they try to follow. DASH diet is one of them. And the principle behind this is just trying to minimize your sodium intake. I know I spoke about that on the previous slide, but this just kind of reinforces it. And DASH means dietary approaches to stop hypertension. But essentially what that means is minimizing your sodium intake day by day, emphasizing fruits and vegetables, low-fat dairy foods, staying away from foods on the previous slide that were mentioned that are higher in sodium. But it requires you to just be more cognizant, pay more attention to the types of food you're eating day by day, because you might actually be surprised. Things that you might think are actually healthy might actually be very unhealthy for you. So I encourage people to, whenever they're buying food at the grocery store, regardless of what it is, I tell them, hey, take a look and see what the sodium content is. You might actually be surprised. There's also the Mediterranean diet that's been brought up over the course of many years. Somewhat of a similar principle in terms of minimizing the sodium intake. But this emphasizes, again, daily consumption of fruits and vegetables, but also encourages fish, poultry, beans, eggs to an extent, and also portion control and limited intake of red meat. Other things that are part of this sort of thought process or diet includes sort of having meals with in a shared setting with family or friends, which again kind of encourages not eating too much food. It also, from time to time, and again, we will talk about this, but enjoying maybe a glass of red wine and encouraging being physically active. All right, just to pivot a little bit away from that, other things that we take into consideration whenever we're trying to talk about prevention or factors that can contribute to high blood pressure. You've probably heard of a BMI or a body mass index. That's one marker that we try to use in terms of predicting somebody's risk of not just high blood pressure, but cardiovascular risk. And essentially what that does is it takes your weight in kilograms over your height in meters squared and sort of gives an idea of where you stand in that spectrum. Are you underweight, at a healthy weight, overweight, or in the obese range? Now, this isn't a perfect measure. There's lots of different sort of ways where this can be inaccurate. So it's a piece of the puzzle, but it's not the only thing that we take into account. And I think that's the general idea behind a lot of these markers that we use to get a sense of what somebody's risk in the long term will be for developing cardiovascular conditions. The same thing goes for measuring body fat ranges. I think that that's imperfect. It has its value, but I think it should be used in the context of kind of the whole picture for the person. This is another one, the waist to hip ratio and the waist measurement. I think a lot of people have seen sort of the diagram that talks about, are you apple shaped versus pear shaped? And there's different ways of measuring that. But the idea is that if you're more of a pear shaped type of person rather than having a lot of abdominal adiposity or fat buildup, your risk of cardiovascular events in the long term is lower if you're more in the pear shaped category versus the apple shaped category. Again, not a perfect measure. It doesn't definitively tell somebody's risk in the long term, but it is an important piece of the puzzle that we use whenever we're trying to make an assessment for this for each individual. All right, so I mentioned this earlier. So myth or fact, red wine is healthy so you can drink as much as you like. This is a topic that I can remember, for years and years and years hearing about that, oh, red wine is healthy and, you should be able to have it liberally as much as you want. And that actually is not quite the case. Alcohol, regardless of what the form of it is actually unhealthy for you in too much quantity. Now, again, this is somewhat of a debated topic. I think that you'll hear from different sources that you either should be having more of it or you should not. My personal opinion is that alcohol probably is a toxin to an extent. So if you drink more of it than you should, you're going to have negative impacts, not just for your heart, but for other organ systems too, particularly the liver and the brain. And that's been shown in a lot of different situations and a lot of different trials to be the case. So when I talk to people about their alcohol consumption, I won't tell them maybe don't drink it at all because I feel like that's a little bit too restrictive for people, and I feel like that's hard to adhere to in some situations. But I just try to say maybe minimize how much you're having day by day or week by week. And I think the guidelines currently are essentially saying that less than 2 drinks per day for men, less than 1 drink per day for women. So it's essentially saying you really shouldn't be having too much. That's the general idea behind it. But like I said before, minimizing how much you're having day by day is probably the best way to approach it. And like I said, consuming too much alcohol can actually raise your blood pressure. I think this also goes without saying. Tobacco use, absolute no-no. There's a lot of damaging effects that smoking can have on your body and your blood vessels and your blood pressure, nicotine and the other components that are part of it. So we absolutely tell people stay away from this at all costs. I know it's very difficult. Some people have been smoking for many years, many decades. It's not easy as saying, oh yeah, I'm just going to stop. But I think what we try to do in sort of combination with seeing me, seeing primary care doctor and other specialists is to try to figure out a strategy with trying to at least, if not cut back, stop smoking completely. I mentioned this before, stress, that's sort of your body's fight or flight response. And it's sort of a interplay between what's going on psychologically, mentally, and the rest of your body. When your body's under stress, one thing that can happen is that your blood pressure can go up sort of as a response to this. And there's different factors and there's different behaviors that can contribute to it. But what the downstream effect that I worry about as it relates to this talk today is it can have a negative impact on your blood pressure and as a downstream effect on these other organ systems that we talked about. So when I talk to people about stress, sometimes it's within their control, as in, it could be they're not sleeping well because they're working too much, or sometimes it's stress that they have absolutely no control over. But we try to talk about strategies to try to reduce that as much as they can. Now, this slide here sort of describes some ways to try to mitigate that. So taking deep breaths, going for a walk, trying to meditate, going kind of stepping away from whatever stressful type of situation might be going on, or even exercising. But we try to work through any one of these things that might help to reduce stress as much as possible. Now, if all of these lifestyle related factors that we talked about so far do not seem to make a difference in terms of making the blood pressure back into a normal range, then we really do start talking about medications. And we may have that conversation earlier if it seems like the blood pressure is a lot higher, but we may be having this conversation maybe after a number of months of working on these lifestyle related factors. There's a lot of different potential medications that we use for blood pressure, and they all have their sort of pluses and minuses as it relates to them, and they all have their own different mechanisms of action in terms of how they help to lower blood pressure. So one class that we use fairly commonly is called thiazide diuretics, and essentially what that does is try to reduce or eliminate the salt out of somebody's body, and by extension bring down the blood pressure. This is one form of something that people will call water pills. There's various types of that, but that's why it's called a water pill. It essentially helps to get salty water out of your body by making you urinate more frequently. Other classes that people may see called ACE inhibitors or ARBs or calcium channel blockers. Those are various types of blood pressures that sort of work sort of in different portions of the blood vessels in the periphery, like in the arms and the legs, but also sometimes with the kidneys to try to help relax blood vessels and lower the blood pressure by extension. So this is kind of a summary slide of things that we've talked about so far. So what can you do to improve your blood pressure? Weight reduction, diet, reducing sodium intake, increasing physical activity, moderate or minimal alcohol consumption. And as you can see all the way over on the right, in this approximate SBP reduction range, we can see significant amounts of change with your blood pressure with making these individual changes. Now, obviously, it's going to be different from person to person how much and to what extent this is going to lower it, but it absolutely will have that downstream effect. And I've seen that play out sometimes to the point where we have people on multiple medications for their blood pressure. They do one or more of these interventions, and their blood pressure comes down to the point where they don't actually need to take as many or any of the medications that they were taking before. But it does require a lot of consistency. It's not as easy to say, oh, I'm going to try doing these things for a week. If my blood pressure doesn't get any better, oh, I guess it's not going to work. This is something that requires sort of sustained long-term work in order to accomplish this. And when I say long term, that can mean several months or obviously years. It's going to be very individualized in that way, but it is really important to make sure that when we have our check-in visits, when I see people in the office, that we're addressing this. Are you making sure you're staying physically active? Are you sure you're not eating foods that are too high in sodium? Are you making sure you're staying away from drinking too much alcohol? So that's usually part of the discussion, regardless of whether or not somebody's on medication. So, in summary, and I know this was sort of a rapid sort of run through all of these particular topics, but generally, the conversation that I have with people and that I recommend is to eat a well-balanced diet that's low in salt, to limit their alcohol consumption, to do regular physical activity, to try to manage stress as best as you possibly can, to try to maintain a healthy weight, absolutely stay away from smoking. And if you need to be on medication, make sure you're taking them consistently because they only will work if you're taking it day by day. So I hope that this encourages you all to make sure that you're talking to your doctor who's kind of helping you through these things, and be consistent as much as possible. As difficult as it may be, that's the way to make sure that we see sustained results in this kind of area. These are some resources that this information was gathered from. The American Heart Association is great, but there's lots of other websites that are reputable. I always tell people to be careful about where they get their information from. I kind of tell them to maybe stay away from Facebook and some of these other websites that might have some misinformation on there, especially as it relates to their health. But these are reputable ones that I know have good data, and I absolutely will refer people to, and I review it often myself, just to make sure that it kind of aligns with my day-to-day practice too. These are sources on the right side from Virginia Hospital Center. So there's cardiologists, different specialties within the cardiology department. The primary care specialty is also really important in terms of tracking and helping with blood pressure. And then there's fitness and healthy lifestyle classes that are available too. So I encourage people to seek out these resources and get checked. That's the only way that you know that these things are going on. This is a disclaimer. This is not a substitute for personal situations or advice, but always seek out medical attention or medical care if you have any questions about these things. Okay. And with that, I will take questions if there are any.
Thank you so much, Dr. Clark. That was very comprehensive and a great overview of the topic. So we appreciate that.
Of course.
I did want to actually mention you brought up, of course, exercise as an important preventative step. And
Mm-hmm.
for anyone that's on this webinar that's looking to integrate a little bit of activity into their schedule, our department actually hosts a free walking program on a weekly basis at Lubber Run in Arlington, and so it includes a walk at your own pace, a short exercise session, and we have a nurse there at least twice a month to provide free blood pressure checks. So I thought that tied in nicely to what you were sharing with us, and
Awesome.
encourage anyone to join us each Thursday for that. So in terms of questions, I just one question was, to what extent do you think the quantity or quality of sleep that one gets has an impact on blood pressure, if at all?
Yeah, that's a great question. I think that comes up quite a bit. I think there's various levels of what can be considered quality sleep. I usually will tell people that if you're not getting adequate sleep, think of that as a stressor on your body. Your body, just as much as you need to be in motion day by day, you need to have adequate time to rest and recover, rejuvenate from what's happened from the previous day. If you're not getting adequate sleep, I would consider that a stressor on your body, which accumulates over time. And I've absolutely seen situations where kind of poor sleep, regardless of what the cause is, can translate into high blood pressure. So I think that's just as important as any of these other risk factors when it comes to kind of figuring out why is somebody's blood pressure high.
Great, thank you. Another question, anything, you mentioned that men are perhaps in general tend to have higher blood pressure, they may present more with higher blood pressure, but any
Mhm.
consideration for women or any changes you've noticed over the years in terms of how women present or any issues that might be specific to women in
I,
this context?
I think this is an interesting sort of uh, difference between men and women in this way. I would actually say I end up finding that I discover high blood pressure in women more often than men. And I know what the data says, but the reason why, and this is my personal experience, is because women tend to come to the doctor's office more frequently than men do. So we end up finding things such as high blood pressure a little bit more frequently as a result of that. Men tend to show up when something doesn't feel right, and in that case, sometimes there's a lot of things going on, including high blood pressure. Now, in terms of how women present, I wouldn't say I see tremendous difference in terms of symptoms as it relates to high blood pressure itself. But I think one of the classic things that we do talk about in terms of presentation for symptoms is as it relates to heart disease, which I would say is maybe an adjacent category, but not exactly the same. So if somebody's having a heart attack, I think sometimes the classic thought is that women will or men will or anybody will come in with chest pain or shortness of breath or anything along those lines. But women may have different types of symptoms. They may have things like fatigue or indigestion, or they may have back pain, or they may have headaches. That might be their manifestation for something like that. Whereas men perhaps might more align with having the classic chest pain and shortness of breath, perhaps that we hear about kind of day by day. But like I said, I think as it relates to blood pressure, I think that there's It's pretty consistent from men to women in terms of the potential symptoms that they might have. I won't say that I've seen more characteristics in women more than men, but at the end of the day, what I usually will also tell people is if something doesn't feel normal in terms of any kind of symptom, pay attention to it and maybe seek out trying to figure out why that may be the case, because it could be as a result of the blood pressure being abnormal, but it could also be other conditions too. I don't think that there's any one condition or one symptom that somebody has that's specific to blood pressure. I think that multiple things can cause you to feel all of these symptoms that I kind of described earlier.
Great. Yes. So be aware of what our body's telling us and seek out help as needed then. Great advice. Thank you. So I'm not seeing any other questions come in. I'll give folks another minute to type them in if anything comes to mind. And actually, while we're waiting to see if there are any other questions, I will mention that next week, again at Lubber Run in Arlington, there is going to be a like a health and wellness fair being hosted for older adults, and that's going to have a lot of opportunity to gather additional information pertaining to your health. There's going to be some folks there giving blood pressure checks as well as doing some other screening opportunities. So just wanted to mention that that's going to be on the 28th, May 28th. And I can include that in the follow-up email to folks if you're interested. Okay, I don't see any other questions, Dr. Clark. I do think we covered it all very nicely, and I want to thank you so much for your time.
Of
Thank you to
course.
everyone who joined us today. It's great to have you. And like I said, I'll be sending out a follow-up email with a recording to today's presentation. You're welcome to share it or review the presentation again yourself. So
Awesome.
I want to wish everybody a very happy and safe Memorial Day weekend. Hope everybody gets a little break, a 3-day weekend. And again, thank you so much, Dr. Clark. Take
Of
care.
course, of course, of course. Thank you for having me.
Bye-bye.
Bye.